You are officially at term now at 37 weeks, but your baby is still considered early term. Yes, your baby can certainly be safely born and thrive outside of the womb if they decide they're ready, but we do not want to rush or force them out before they are ready to come. Birth is safest for you and your baby when they are the ones to choose when to be born. Before we go on, I'm Bridget Tyler. I'm your childbirth educator, a birth doula, and a mama. Subscribe to this channel and hit the bell so you get updates on all empowering educational videos that come your way. Now let's talk about baby. They are now the length of a bunch of kale, but they're all scrunched up in your belly. They're likely head down, but if not, you might start to panic thinking your only option is a C-section. Take a deep breath. It is not your only option. You can check out the resource link down below for flipping a breech baby and start doing those things religiously from here on out until your baby is head down. You can be seeing a chiropractor or a pregnancy body worker, doing acupuncture, moxibustion, swimming, or talking to your provider about an external cephalic version or ECV, where they manually turn baby in the womb from the outside. Stress creates muscle tension in the body, including the womb, and we want a soft and supple uterus that your baby can easily move around in to find their best position. No matter what position your baby is in, I recommend listening to my affirmation meditation, Positioning Baby in the Womb. And if you want to download all the meditations, especially for labor for easy access, you can find them in the description below. Now, as baby is growing more and more, mama, you might find yourself experiencing some leakage, otherwise known as urinary incontinence. You might find yourself wondering, am I peeing myself or is this my water leaking? So let's talk about some of those differences. First of all, note the color of the fluid you're seeing. If it's yellow, it's likely pee. Healthy amniotic fluid is mostly a clear color, but is slightly tinted yellow, so if you're really well hydrated, your pee might look a lot like amniotic fluid. But next, let's note the smell. Pee often has a slightly acidic ammonia smell to it. Amniotic fluid should be odorless or sometimes even sweet smelling. But again, if you're well hydrated, your pee might be pretty much odorless too, so let's keep using our deductive skills. If it's your amniotic fluid, it will keep leaking. Usually it will release little by little, especially as you get up and walk around. And this is because your vaginal canal is shaped like a J. So the fluid will pool and then you will get up, and as it straightens out a bit more, it's going to come out. If you pee yourself, it's likely not going to keep releasing over the course of several hours, but sometimes baby's head is right on your bladder and the pressure is just too much. One trick you can try is getting into an open knee chest position with your chest low to the earth and your hips high up in the air to kind of reposition baby and see if it affects the leakage. If it stops, it's not your amniotic fluid, but if it continues, it might be, and you should notify your provider. It's a really simple test to check whether or not it's pee or amniotic fluid. Some fluid is put on a pH test strip, and depending on the color it turns, it will tell you if it's urine or amniotic fluid. Pee is acidic and amniotic fluid is alkaline, which is how you'll know. If you are concerned with it being your water breaking and you're leaking amniotic fluid, you should certainly let your provider know, and they can always check. It's always better to be safe than sorry. At this point in your pregnancy, you also might be noticing more vaginal discharge, and this could be your mucus plug being discharged from your body. Sometimes it happens in little bits over several days or weeks, or sometimes it comes out in one big glob. This is totally normal and could be a soft sign that labor is starting soon, but is not a sure sign. So those are the big things happening this week, mama. As you get closer to meeting your baby and your patience and your comfort is running out, I really encourage you to put together a list of things to do before baby comes. This is going to help make time go faster and help you avoid putting life on hold just waiting for baby to come, because that can drive you crazy. Some ideas for this list are prenatal massage or foot massage, Epsom salt soak with candles, making something by hand for baby, meal prepping for postpartum, date night with your partner, day trips, or whatever you want on that list. Patience at the end of pregnancy is one of the best things that you can give your baby. So that wraps up this week's update. I'll see you next week at week 38. Bye, mama.